We already mentioned that asthma is the most common chronic disease of children, but it's surprisingly at times difficult to diagnose. The kind of asthma that is most difficult to diagnose is what we call cough variant asthma. When children wheeze, when children have a lot of respiratory distress, it becomes a little bit more obvious, and people tend to associate those symptoms with symptoms of asthma, especially if they tend to be recurrent, if they happen again and again. But there's another kind of asthma, as we mentioned, cough variant asthma, where the child doesn't wheeze. When you listen to the child, there is no wheezing, but the hallmark of this kind of asthma is repeated and very severe episodes of cough. It usually happens 2-3 days into a cold or exposure to a trigger, something that sets off these symptoms, and the child tends to cough repeatedly, cough more severe than you might expect with just a cold, and it tends to be more severe at night. For reasons we don't quite understand, when nighttime hits and the child is trying to sleep, waves and spells of cough, sometimes even leading to choking, gagging on the sputum the child produces, is very much a hallmark of asthma. And if in doubt, sometimes a trial of the treatment of asthma with the albuterol may be what's needed to see if that gives a child relief and if that may indeed be what's masquerading.